Hello, everyone. This is Todd with Dab's Computer. I appreciate everyone taking the time to get on the call with us today to view a demo of CureMD. I think we've got Eddie from CureMD who is going to do the demo today. We have been a CureMD partner for about 3 years. It is a great product. It fit really well into our customer base and really complemented the products and services that we already offer. And so we're always looking for opportunities to show people other solutions or ways to improve their practice. And CureMD does a good job of doing a lot of that stuff. So I'm going to go ahead and turn it over to you, Eddie, and let you show us what CureMD is all about.
Sure. Thank you very much for the introduction, Todd. My name is again Eddie Malik. I'm the Vice President of Sales over at CureMD. One of my reps, David Thompson, he's going to be doing the product demonstration for everyone, and we'll be doing a Q&A session toward the end of the meeting. If you have any questions, feel free to throw out or write out any questions over to us, and we'll be going over them toward the end of the meeting. And if you miss out on any, we'll make sure to answer them via email and send them back to you. So what we will do is we'll wait for an additional 5 minutes, Todd, if that's okay, and then we can go ahead and begin the presentation if you like.
Yep, that's great. Thanks, Eddie.
All right, so we'll wait till 5 more minutes and then we'll start. Okay? Thanks. So guys, we're gonna begin for the presentation. So I'm gonna hand the mic over to David Thompson, and he's gonna go ahead with the presentation. Okay?
All right, everybody. So again, my name is David Thompson. Thank you so much for joining me today for the CureMD webinar. All right, so right up here, guys, this is my sign-in screen. So each and every member of the staff will have their own unique logins. They simply input their username as well as their password, and then it will bring them to their default landing page. Now, as a practice administrator, I have my default landing page set up as the personal dashboard. Personal dashboard is a customizable dashboard that gives you a view of exactly what you'd like to take a look at as soon as you log in. We can drag and drop from the components on the left-hand side over here in order to customize. Some things we can take a look at are things such as messages, tasks. We also have the ability to do bidirectional lab interfaces. So if you'd like to see which labs you've received every time you logged in, you can see that directly from here. Now, also importantly, we have our KPIs, or our key performance indicators. You can see them over here: monthly visits, revenue collection ratio. We also have things such as your AR. And anybody who has the permissions to view these can take a look as soon as they log into the system. All right. A few other notes on navigation. Up here, you can see all the different modules, so we can navigate through CureMD using the modules, such as the patient module, scheduling module, electronic filing cabinet, which is your document manager, billing, claims, as well as our chronic care management and our MIPS and MACRA module as well. All right, so guys, let's go ahead and get started on a patient journey. So what I'm going to do is just go right here and go to my scheduler. All right. So I'm hopping right into my scheduler. Now, right over here, we have a daily view for a single provider. So we have provider calendars, which we can toggle between here, as well as resource calendars. So a resource calendar is anything that you guys need to schedule that is not for a provider. We also have some quick views down here. So this is my quick view of this month as well as next month. Green, this means that the day is completely available. I currently have no appointments booked. Yellow, this means that my day is partially available, and it will show me exactly how many appointments I've booked. And if you were to see red, that would mean that you guys are completely booked up for that day and have no more room to see patients. We also have a weekly view, so you can view all the appointments for the week. Multiple, where you can look at multiple providers and or resources up against one another. And then we have the enterprise view that allows you to look at multiple locations up against one another. All right, so start the front desk workflow. Patient calls in, says they would like an appointment at 11. First thing I'm going to do is ask them if they're a new patient or an existing patient. If they're a new patient, I can simply hit quick add over here and input some basic demographic information from the prospective patient. Once I have their basic information, I can go ahead, send them the patient portal, log in, and they can go and do demographics, insurance, histories, consents, and more directly from there. If I can get it over the phone, I can also input my patient's insurance information, and what that allows me to do is run the instant eligibility verification right then and there. So while I'm still on the phone with a prospective patient, I can see whether or not their insurance is eligible and let them know if there's an issue right there. All right. Otherwise, if it is an existing patient, we can search based off any of this criteria over here, or we can use our hot list. So hot lists are a tool that we will find throughout the application, and essentially what they do is recommend information for us. Now, because I'm on the scheduler, it's recommending patients who I may want to work with. So directly from my hot list, I will start and choose Jason Taverner. As soon as I click on his name, I'm going to get my appointment results screen. So from right here, I can just go and choose. So I'll say he's here for his first visit. We can have durations as well as note templates automatically associated with that visit reason. Now, if it's a recurring visit, we simply click on this arrow right over here, and that will allow us to input our rules to quickly add that recurring. Now, once I'm all set, I can hit schedule, schedule and print, or schedule and send SMS, which will send a text message directly to that patient. Now, this is especially helpful if the patient is requesting an appointment through the patient portal. All right, So I'm just going to go ahead and hit schedule right over here. Now this is letting me know that the primary plan requires a referral. So this is to help cut down, and it's asking me if I want to attach it now. So I'm going to say yes, and then I'm going to go into all of the patient's current referrals, and I can choose from my list. Also, the system will automatically count down how many visits I have left, which I can review right over here. Alright, and now I'm all set, and I can go and hit schedule and send SMS, and again that will send the patient a text message. Because it's not a live system, I got that it had failed. Alright, so now that we're all set, the patient is scheduled, we can see in blue. Now you'll notice right next to his name we have a P, which stands for pending. Now in a live system, as soon as you schedule the patient, you'll get one of two things. You'll either get an E for eligible or ER for eligibility rejected. You can click directly into either of those. So if the patient is eligible, you can click into that E and take a look at the complete plan and benefit details for that patient. On the other hand, if it's an ER, you can click directly in there and you'll see the exact reason why the eligibility was rejected, and either you or your patient can go ahead and inquire with the insurance, or maybe just simply fix some text that was misinputted. Alright, so let's move ahead. Jason has come in. I'm going to go right here and hit check-in. Now this is going to bring in Jason's check-in screen. Right over here it's going to show us some of our balances, so insurance, patient. Alright, his copay is going to automatically come through from the insurance information we have in, and I'm just going to hit paid. Now as you can see guys, because he required the referral and we did that during the scheduling process, we can see it right over here. Now I'm just going to hit save, and that is going to check my patient in. Alright, and we can see right next to him over here we have the green $sign, which indicates that he has paid his copay. If the patient had not paid their copay up front, we would get a red $sign there indicating that the patient has not paid his copay. Alright guys, so now let's move to our next thing. So we're going to go into the patient's chart now. Very easy to navigate to a patient's chart. I can just hit patient demographics, or I can go directly to my patient module. So my patient module has all my patients in it. I can add a new patient, I can import a patient, I can search based off any of this criteria right here, or I can go back to my hot list. So I'm just going to choose Jason again from my hot list. Now right here guys, as a administrative staff, I will go directly to my demographics page. Now up here, these are all of our standard demographics fields, okay? Asterisks, that means that we've marked this as mandatory information. Now below, these are some examples of custom demographics fields. So custom demographics fields can also be built into the system, and what's really cool about them is that they are also reportable, so we can use these to run any specialized reports that we would like. Alright. Now next I'm going to hop over to insurance. Alright, so this is where we can have our patient's primary, secondary, as well as tertiary insurances. To add a new one, I would simply hit this add button right over here. Alright, from there I'd have a drop down list of plans I'm credentialed with. If there's any addresses that I need to choose from, if I have multiple addresses, can do it right there. Or then the patient or I can simply go ahead and input this information. Now, demographics, insurance, contacts, consents, patients can all do on their own, either A, via the patient portal, or B, via the kiosk app for the iPad. Alright. Next, hop into contacts. This is simply where we can have responsible party, support party, as well as in any workers' comp cases, we can have employer and lawyer information filled out right over here as well. So very straightforward. Consent forms. So we give you a number of different ways to do consent forms electronically within CureMD, so you don't have to do all the scanning and printing. Way number one, as I mentioned, is the patient portal. Way number two is through the kiosk app, or way number three is via an electronic signature pad. Of course, you do always have the option though of scanning it directly into the system. Now guys, I'm going to hop over to preferences. Preferences allows me to set a variety of preferences. The two I'd like to point out are preferred pharmacy as well as alerts. So with pharmacy, we are a gold certified partner of SureScripts, which gives us a lot of neat functionalities that I'll highlight as we go through the system. Below here, text and email. So CureMD has text and email alerts, all right, that can be sent out to the patients. Text can be customized, rules can be customized, and that way for things such as scheduled, confirmed appointment, follow-up visits, and administrative alerts or clinical reminders as soon as I get a lab result, or even a birthday greeting. We also have the ability to do phone call reminders as well. My last tab up here, guys, is restrictions, and that is simply if I would like to restrict access of a patient's medical records from any other users in the practice. Alright, so that basically sums up our front desk workflow. Now let's go ahead, change gears, and do our clinical workflow. Alright, now as clinical staff, I would most likely set my default patient landing page as the clinical overview. Very similar to the personal dashboard, the first thing that we took a look at, this is a customizable dashboard. You can drag and drop from the left-hand components so you can see the most relevant information to you as soon as you come onto a patient's chart. Alright, now let's start our MA workflow. First thing I'm going to do right here is complaints. I can take a look at any past complaints right over here. Once I'm ready to add a new one, I can simply hit add. Alright, now let's say the patient came in today for a cough. Alright, now I can search. I have hot lists as well as favorites list over here. So I'm going to say that he came in for a cough today. Alright, how long has he had the cough? 1 week? When does the cough occur? Middle of the night? Alright, so I'm just going to keep filling these out. Now, a very cool thing about these are they are completely customizable. We can customize text. We can customize whether or not we'd like something like a drop-down menu, such as in the sore throat. And once we hit save, this will automatically generate a narrative HPI for us. The other thing that it's doing is keeping track of different points, different things that you've done for the patient, which goes into our E&M coding calculator. So we do have an E&M coding calculator in the eSuperbill, which will automatically recommend a level of visit to help ensure that you guys never accidentally underbill for a visit. Alright, and as you can see from those 3-4 clicks that I made, we have a complete HPI listed out, ready to be brought into the provider note. Now guys, I'm going to hop into history. Family, surgical, social, medical, birth, precautionary, as well as for female patients, we have the OBGYN history. Alright, so for example, let's hop into our social history right over here. Tobacco, alcohol, drugs, sexual, occupation, education, sleep, diet, exercise, as well as the optional tanning tab. So for example, I will say that he's a former smoker, just choose from my list. He smoked cigarettes, smoked a pack a day, he smoked for 4 years, and he recently quit. Alright, alcohol, very similar. I'm going to put in what his status is, length of usage, frequency, if he's quit, length of cessation, and I always have the ability to put in any additional comments. Also guys, right over here with these two, if there's no tobacco, alcohol, or drug abuse, we can simply click that, and that will indicate all of those. Alright, so now I'm going to go ahead, hit save, and now his social history is updated for today. Very similar workflows in family, surgical, and the rest. Now next thing I'm going to do is go into my allergies right over here. Now, right here we can see he's allergic to penicillin as well as pollen. Alright, if I'm ready to add a new one, I simply hit add allergen, select my allergen from the list, put in severity, onset, as well as reactions. Now within CureMD, we have interaction checker. So it does 3 things. It does drug to allergy, as well as drug to diagnoses. Now for example, because Jason is allergic to penicillin, if a provider were to try and prescribe him amoxicillin, they would get an alert letting him know exactly what that interaction is, alright, the severity of the interaction, as well as additional information. Next, I'm going to go into medications. So I can take a look at my current as well as my past medications. I can manually add in current and past medications using this add button. However, through SureScripts, we have this button over here, which is the RX History button. Now, if you click that button, it will automatically bring in the patient's current and past medication history to your specified time frame. All right. Now, keep in mind, everybody, histories, allergies, medications, any custom forms and questionnaires can be done by the patient on the patient portal before they even come in for their first visit. Alright, next guys, I'm going to hop over to my review of systems. Alright, I can take a look at any past review of systems right here. You're seeing the two different formats we have, so we can make these in whichever way the practice prefers. Alright, these can be made. So we have both the admits denies sort of classic format as well as the narrative format right over here. So I'm going to hit add. Alright, and then from my list, you can have any number of templates. I'm going to choose my preferred one, which is the general. Now we have all of our systems listed up here. Alright, we also have all of the characteristics down here. Now, as you guys can see, I have everything automatically marked off as no significant issues, and that's to help us save time in documentation. Now, he came in for a cough today, so even though we reviewed all these and they're normal, we only need to make changes in the respiratory area. So I'm going to say he came in with some chest pain, alright, a non-productive cough, as well as a bit of a fever. Once I'm all set, all I need to do is hit save, and now we have all of these systems documented in just a few clicks. Next, guys, we're going to hop into vitals. Okay, so we have growth charts, weight trends. We can see all of the past vitals here. We also automatically indicate in CureMD as to whether or not past levels were high or low. So as you can see here, red, that means it was a high value. All right, orange means it was a low value. Also, if any multiple readings were taken, we can see that right over here, hover over it, and see what each of those were. Now I'm all set to add my vitals, simply going to hit add right over here. Alright, now as an adult patient, I do have it so his weight and height automatically comes through. Of course, I can always go ahead and edit those. His BMI, BSA, category are all going to show up right here as well automatically for me. Now I can just quickly input my vitals right over here. Alright, so I'm just going to put in his pulse, respiration, temperature, as well as blood pressure. Right, we also have some additional fields down here. Now we also do have the ability to interface with many different vitals devices, which is why we had that import button, which can automatically bring in that information as well. Alright, so guys, this concludes the MA section of the workflow, and now I would like to hop into the provider. Alright, so again, we can get to the patient's chart from the scheduler, we can get to the patient chart from here, but we can also get to the patient's chart by today's patients. So today's patients is a triage menu. It will show you who's currently checked in, what their status is, what their room number is, and you can even create your note directly from here. Now, I still have the ability, alright, to go and do my clinical overview. So this allows me to refamiliarize myself with the patient just before I go and create my note. Alright, so now I'm just going to hit create note right over here, and it's going to take me directly to the area where I can select my note template. Alright, so currently it's defaulting to blank, and a blank note template allows you to pull in a past template. So if the patient's coming in for, a routine follow-up and a series of follow-ups, and you may have minimal, if any, changes to make in the note, you can just choose that option. Otherwise, I'm just going to go in here and choose my note template. Now keep in mind, guys, this is a demo database, so it has tons and tons of content in here. So for your practice, you would only have the specific notes that you guys would like to use. Alright, the appointments link, so everything I did today, again, will pull over into the super bill as well as go into my interaction checker. So now I'm going to hit create. So for the purpose of today's webinar, I'm going to show you guys a very basic SOAP note. Alright, so as you guys can see, we are Microsoft based. which makes it very easy to customize our notes, as well as adoption very easy for practices who come over to CureMD, because just about everybody is familiar with the Microsoft format. All right, so right here, notes are made up of a few main things. Right, these are fields, so this is static information brought in from just about anywhere within the system. So for example here, I have today's date, referring provider, all right, as well as time. I have his name coming through, all this stuff. Now we also have a logo up here, so we can embed your practice's logo directly onto the top of the provider note if you guys would like. We also can put as much free text or pre-formatted text within the system, and then the real comprehensive part is right here. These are the discrete reportable components, so things such as complaints, histories, review of systems, diagnoses, procedures, physical exams. All of that will be on here. All right. So also in any of this white space, we can free text or we can use macros. So if you see over here, we have these, what we call smart phrases. So these can be built into the system, all right? And you can either type those in, or you can just hover over it and that text will go directly into where your cursor was within the note. All right, so now I'm just going to scroll through my subjective. All right, so my MA has done all of this. I'm just going to review it. The review of systems, great. Now keep in mind, I can make any changes that I'd like in anything that my MA has done. So let's say I'd like to make a change to the review of systems. Simply click into this review systems, make my changes, and hit accept or next. Now guys, for the purpose of today's webinar, I will be hitting accept, which takes me back into the general note. But if I were to hit next, that would take me into my next available component, which in this case would be the vitals area. All right, I've looked over everything and now I'm ready to document my physical exam. So simply click into my physical exam component. Now, very similarly to the review of systems, these can be set as automatically populated. All right, so for example, I have everything marked off as normal. So there's really no reason for me to do extra documentation here, do more clicks, because the only thing that's really relevant to today's visit may be the respiratory. So I'm just going to uncheck normal, all right, and put in my findings. Now keep in mind, these are quite customizable, so you can customize systems as well as characteristics. And as soon as I hit accept, that is going to update today's physical exam. Some other cool features of the physical exam are that we can have drawings in our physical exam. So if I go back in here and I hit this medical drawing, okay, that can open it up. I can choose an image, all right. So from there I can go draw on the image, put check boxes, X's, even do free text, and then that will come directly into my physical exam and be visible on the note. All right. So we've done our physical exam and now we're ready to add in our diagnoses. So I just go into my diagnoses. Right now I'm on all my current diagnoses. I can see all my past diagnoses. Once I'm ready to add new diagnoses, I simply hit add over here. Right now, guys, we have a few different ways of finding diagnoses. We can search by code, whether ICD-10, or if you guys still remember your ICD-9, you can just type in that ICD-9 code and it'll give you all of the corresponding ICD-10 codes to choose from. This is another area where we have our hot list, so this is going to recommend, in this case, based on what I've used recently. We have favorites list, which is one of my favorite tools, all right, because within 2 clicks, you can find the exact diagnoses that you'd want. Now, what happens though if we're not exactly sure of the diagnoses? That's where we have this provider-friendly terminology. So let me go ahead and put in knee sprain. All right. Now from here, it's going to give me a number of different codes. So I'm just going to choose knee sprain. But you see right here, it is asking me to refine. So I'm not exactly sure. So I'm going to say, yep, this is the initial visit. It is the right knee. All right. The disease process site. So I can just choose from there. And then it will give me a recommended code to come directly in. All right, otherwise, once I'm all set, I can simply hit accept, and now I'm ready to go into my next component. My next component over here, guys, is procedures. So here I can mark off any of the procedures that I've done today. Again, search, favorites list, hot list, and now these are ready to be brought into the eSuperbill as well as be saved on my provider note. Lab order. So guys, as I mentioned when we first got on and took a look at the personal module, we can build bidirectional lab interfaces with just about any lab in the country. Alright, so again, from here, we can choose which lab we would like it to go to, including an in-house lab. So if it's an in-house lab, those codes will automatically go to the eSuperbill. Otherwise, I can search, use my hot list, or use my favorites list. Now, a neat feature with favorites list is if there are labs I always like to order together, I can make a favorites list out of them, simply hit that button over there, and order all of the tests. I hit save and accept, sign and accept, and now it's automatically gone out to, let's say, a Quest or a LabCorp. Your patient go in there, and then the results are going to come back directly into CureMD electronically. Now I'm ready to prescribe a medication, so I can go into my prescription over here. Now I have a quick check, so I can quickly look over my allergies, diagnoses, as well as current medications. Otherwise, I can search for medication up here, use my favorites list or hot list. Now, one really cool feature about CureMD is it does the formulary check. So I typed in Xanax, which is a brand name. But next to it, all of a sudden, I see an orange that the generic name is coming up. And so basically there, the system is telling us that the patient's insurance does not cover the brand name and is suggesting that you prescribe the generic just so the patient doesn't have to pay a lot out of pocket, or your staff's getting a call from the patient, hey guys, what is this? I can't afford the medication. Can you guys please re-prescribe the generic? Alright, so from here, I'll just click. Alright, I have recommended SIGs, I have saved SIGs. Alright, and you see right here, it's checking the interactions. There's an interaction found. Okay, I can click in directly to that interaction and see exactly what the interaction is and whether or not I would like to override it. Right, then all I need to do is hit prescribe, guys, and it's out to that patient's preferred pharmacy. Alright, if the patient does have another pharmacy, you can just go in here and select another pharmacy. Alright, next, guys, we have patient education. Now, your own patient education can be uploaded directly into CureMD, but CureMD also has an interface with Medline Plus. So it's going to scrub the note, give me some recommended education. Alright, so I can just choose right here asthma. I hit this sign and it will take me directly to Medline Plus's website where I can review the education of the patient, print it out, whatever I need to do. Once I'm all set, I can just say that the patient has a good level of understanding, they verbalize my understanding, and now we're all set. Alright. Now, my assessment and plan. So, CureMD has a powerful tool called custom forms, and these are essentially custom components. Very good for procedures, questionnaires, as well as assessment and plans. So for this visit reason, I have it auto-populated with the things that I always speak about with the patient for this visit type. Alright, now let's say that today I also spoke about hypertension with my patient, right, as well as the medications. I'm just going to update that, hit accept, and now whatever updated, whatever is checked off, will come directly into my note via the custom form. Alright, so now I'm all set and I would like to schedule a follow-up for the patient. I simply go into my follow-up component right here. I can say I would like the patient to come in 2 weeks. I can attach my reason right over here, and then I can have it assigned to myself, or I can also have it assigned to a user or group of users. So for example, I would like to assign this to my front desk user group. That way all of them will have it as the task, and whoever completes it first, it will be marked as complete for everybody. Alright guys, so I'm all set and I've done my complete note. Alright, now once I'm all set, alright, I can sign off on my note, I can send it over, fax it over, I have letter templates, or I can just go ahead and create my eSuperbill. Alright, so as soon as I hit my Create eSuperbill button, it's going to load in all of my diagnoses, all of my CPT codes, alright, and it's also going to give me a recommended level of visit, which in this case is a level 1. Now, I want to know why it's recommending me a level 1. In the past, from past experience, I know that this must be at least a level 2. I can go, how is E&M code recommended? So this is going to give me an overview of everything I've done today, and then when I get down on the bottom, I'm going to go into that 99212. And what it's saying is that in order for this to be considered, I would need to have one more point from my chief complaint, as well as one more point from my management options, which we can see over here. Alright. So I'm just going to mark off level 2. Alright, now as you can see, we have our diagnoses all up here, as well as all of our CPT codes. Alright, or lab codes. And now in the system, all of the fee schedules will automatically be attached. Alright, so you won't have to go in and put in specific ones every time. They will all be here. Now, once I'm all set, I'm ready. I'm going to hit save and sign. And now I'm all set with my provider note, and billing is ready to take it over from there. Alright, so that is my brief overview of the provider section of the application. Next, guys, we're going to take a quick look at billing within CureMD. So billers will mainly be working out of the billing, claims, as well as reports module right over here, where we have over 100 different reports pre-built into the system. Alright, so now I'm going to go into my billing module right over here. Alright, I want to take a look at today's eSuperbills. So I have an eSuperbill today for Jason, it's signed. I want to go in here and create my charge. Alright, so I can look over the eSuperbill, alright, make sure I don't need to append anything, and now I'm going to go and create my charge, and it's just prompting me because I have not yet signed off on the provider note. Alright, now on my charge, all of my diagnoses codes, all of my procedure codes, fee schedules are automatically going to come in here. I can review them, alright, make any changes such as adding a modifier, pointers, units. Alright, now because it's tied into today's visit, alright, location's automatically going to come in, date, because we added the referral as well, that referral number is going to automatically populate. Once I'm all set, simply going to hit save. Alright, now we are getting an alert, so it says that the charge falls in the global period. Are you sure I'd like to proceed? And I'm just going to go ahead and hit continue. Alright, so we like to do a lot of pre-checks to make sure that all of your claims go out without issue. Alright, so now I'm done. I can work on additional super bills and create the claims. Now guys, I'm going to go into my claims bucket over here. So this is our claims bucket, alright, newly created, processed, as well as our remittance advice. So clean, these are all of my clean claims, alright, and if I would like to, I can just hit this button right over here. It's going to automatically select all my claims. I can hit generate claims, and now they have gone out to the clearinghouse. Incomplete, these are any incomplete claims. There may be some fields missing. I can click in there and put those fields, and then it will become a clean claim. Now process, guys, for claims management, overdue bucket. So overdue, these are any complaints that have been more than 30 days and we have not gotten paid on or heard back from. Alright, so we know that we may need to resubmit, do some work, or follow up with the insurance. No response, these are ones that were automatically bumped back from the clearinghouse. I just need to rework these and send them back out. Rejected, these are all of my rejected claims, and I can see the exact reason why they were rejected right over here. Just can click into my area and then automatically from one screen input whatever information I need to. Now once you're all done and you've marked everything as corrected, they'll go into the corrected bucket, and very similarly to the clean claims, we can click all and send these back out en masse. Any secondary, tertiary insurances can be found directly over here. All right. So now we've sent the claims out and they've been paid. We can go into our remittance bucket right over here. So my remittance bucket is going to show me everything that has come in. It's going to break it down by plan. It's going to break it down by patient, as well as what we're getting paid for each of those patients. Once I'm all set, again, I can go into each of these individually, take a closer look, or I can just hit select all, hit post, and now these will all be posted to my bank account. And that is the brief overview of the billing and claims area. Okay. So next thing I want to go into, guys, is our document manager right over here. All right, so document manager, this is your electronic filing cabinet for the patient. All right, so I can search for a patient. I can choose one of my patients from my hot list. Now, guys, if I choose Jason right over here, this is going to show me all of the folders I have. So folders can be customized. You can have as many folders as you would like in the system. All right, so right here, I have my fax inbox. So CureMD does have integrated e-faxing within the system. I can see all of my incoming faxes. I can double click on them to view them, and then I can just drag and drop them into the necessary folder. Other thing we have here is File Explorer. So that's File Explorer from your desktop, as well as Batch Scan, which is all the scans that are coming in. All right. Another thing I'd like to show you guys for today's webinar is our quality programs dashboard. So CureMD itself is a MIPS registry. All right, so right over here, quality improvement activities, as well as promoting interoperability. It will break down all of my scores for me, as well as give me my composite score right over here. I can click into each of these and see exactly how I'm doing with each of my measures. All right, next I'm going to hop into my financial impact within the quality programs area, and this is just going to give me an overview, all right, of my MIPS macro revenue right over here. All right, and right here, this is the settings area, and this is where I can go and input the measures that I'm going to be working with, which makes it very easy for you to see all of your patients that meet these measures, all right, and they can go directly into CureMD's quality programs bucket, and then we can be sent out through us as a registry. All right, so from here I'm going to choose my reporting method, whether it's individual or group, my performance category, all right, my reporting period, entity name, as well as provider or providers that I'd like associated with this. Simply hit save, and now we're all set. Right over here, these are the measures, guys. So what the measures do is they give me an overview of all of these measures. Okay, I can search through, I can take a look at them, I can choose the different entity. All right, and as it says right here, you can see a minimum of 6 measures are required for the quality category. So it's a great place and a really easy way directly within CureMD to document as well as report from MIPS as well as macro. Right. And that concludes this portion of today's webinar. Thank you very much for joining me, everybody.
All right, guys. So thank you, David. Let's see if Todd, would you like to go over any Q&As currently? Todd, can you hear me? Lisa, are you there? Guys, we'll wait for an additional 5 minutes. If you have any additional questions, please write them out and we will answer them. If not, we will end the session and you can send any questions that you may have over to Todd as well as Lisa and we'll get them answered for you, okay? Okay, guys, so as there are no more questions, we're going to end the webinar. If you have any additional questions that you think of afterwards, please be sure to send them over to Todd Dabbs or Lisa Ellinger from Dabbs Computer Consultants. And you all have a great rest of the week, and we hopefully look forward to working with you. Take care, all. Bye bye.